The COVID-19 outbreak in the U.S. left the country in shambles. Hospitals were overwhelmed with cases that led to many tough choices and heartbreaking outcomes. Our healthcare system was depleted, with limited space, staff, funds, and supplies in times of a pandemic. While the system was breaking at the seams, not everyone was able to receive the same quality of treatment. The sickest of the sick and the most at risk were placed at the highest priority, rightfully so. Unfortunately, minority groups were often at the head of this issue. In most cases, they were exposed at a higher risk and experienced worse symptoms, but they were not given higher priority. Currently in the U.S., there are prevalent health disparities among low-income and minority groups, including Black, Hispanic, Latin, Native American, and immigrant populations. In the case of a global pandemic, where healthcare resources are already limited, these health disparities were highlighted to reveal that some groups receive better health care than others. Furthermore, health disparities and social determinants can predict nutritional status in terms of what one can afford. Typically, these disadvantaged groups experience nutritional disadvantages and subsequent health issues, including obesity and cardiovascular disease. In this video, I plan to discuss the ways in which health disparities have shaped the COVID-19 pandemic, and with this, highlight the changes that should be made to improve and widen our healthcare system for all populations. Minority groups, along with low-income populations, are at a disadvantage to receive proper healthcare in comparison to white populations. Social determinants including healthcare access, income, housing and neighborhood density, job security and education, contextualize these issues and predetermine the kind of healthcare people will receive. In today's system, minority groups have less healthcare access, lower income, housing in high-density areas, lower job security, and lesser education, all of which have negative effects towards nutritional health and healthcare. For all of these reasons, these populations have experienced greater exposure to COVID-19 and oftentimes more severe cases, but without the same level of healthcare that white populations receive. Social determinants play a major role in the spread of COVID-19 for these groups. These groups are more likely to live in high-density housing and densely populated areas. These areas do not allow for proper social distancing and therefore increase transmission of disease. Minority groups are more likely to have service jobs, where time off and the opportunity to work from home is practically non-existent, once again increasing transmission of disease. Even though these groups are experiencing an increased risk, they are not able to receive the same kind of healthcare and proper treatment. The CDC website discusses these issues and highlights the number of obstacles these groups face. Limited healthcare access, communication barriers, and increased exposure are just a few examples of this widespread issue in the U.S. As an example, in Chicago, where less than 33% of the population is Black, 50% of positive COVID cases, and 75% of confirmed deaths were Black people. This explicitly shows how the lives of minority groups expose them to much worse health and health care at higher rates than white people. In terms of nutritional status, these groups are often not able to access healthy options, either because they cannot afford them or because they do not exist in their areas. Poor diet, obesity, and type 2 diabetes are all risk factors for COVID-19 and are ultimately caused by the nutritional disparities that these groups experience. Each of these is typically, in part, caused by the Western diet. The Western diet is very high in fat, including high amounts of saturated fat and refined carbohydrates. This diet can have aversive effects, including chronic activation of the innate immune system and inhibition of the adaptive immune system, which can impair the actions of the body to defend against viral pathogens. In addition, studies have shown in mice that a high-fat diet, like the Western diet, can increase macrophage infiltration in the lungs. This is especially an issue for COVID susceptibility, where infection occurs in the lungs, consisting of lung tissue inflammation as well as damage in the alveoli. In addition, a diet high in fat is a major cause for obesity, which also puts people at a greater risk for COVID. As another example, this was seen in the Bronx, where out of all the New York boroughs, hospitalization for COVID was the highest, and higher rates of obesity and diseases were also observed. The healthcare system in the U.S. seemed to have been built on racial and economic inequalities. White and wealthy populations have the best access to healthcare, while poorer and minority groups do not receive the same. There is a lot of work that needs to be done in order to change this, and it is nearly impossible to pinpoint a single solution. It is very clear that this issue goes beyond nutrition concerns. That is only a part of the issue. This is a multifaceted problem that has developed more over the course of this pandemic. To start, we need to develop education programs and/or clinics in these communities to make them aware of their healthcare options and to better equip them to live a healthy lifestyle. Healthcare in general should be more affordable and more accessible for everyone, and these groups need to be exposed to all kinds of options to make sure they get some form of adequate care. Nutrition education would be a great tool to help teach these groups how to achieve a proper diet. As I previously discussed, the Western diet is especially harmful for these groups who are already at risk, and it can predispose them to health issues later in life. What is best for these groups is a diet with a high variety of fruits, vegetables, and nutrient-dense foods that strengthen the immune system and boost bodily functions. In addition, nutrition systems such as health food packages or delivery systems to these communities could boost overall immunity and help prevent obesity and/or diseases in the future. By somehow expanding our resources and making healthcare more accessible, these minority and low-income groups could receive the higher level of healthcare they deserve.